Dan, you're at the top left of my screen. I'm not sure where you are with everybody else, but your topic for the day was around concussion and the assessment of concussion, particularly in the early phases, and some of the tools available. So are you able to talk to us about some of the new tools that might be available for clinicians to use out there?
Yeah, sure. Cheers, Mark. Look, I think everybody's pretty familiar with the sport concussion assessment tool because it gets used around the world, and that's a really strong tool. It's got heaps of value. It's got some bits in it that are really helpful, but some bits that are not quite as helpful when you're trying to do what you're trying to do in a concussion consult, which is make sure that you don't miss the things that are a lot worse than concussion, and then try to work out for those who are concussed what sort of prognosis they might have, who's going to get better relatively quickly, who might not. So there's certainly some utility in that tool around the symptom score, but what's quite cool in New Zealand is we've got this New Zealand specific tool called the BIST, so the BIST. It's actually, we're up to version 2, so it's called the BIST 2. And that's a neat little tool which you can find online. It's been produced by ACC in collaboration with some of us, but also some other experts. And it's really a great way to work through a concussion consultation. It's got some good stuff at the start. So it's got some information about red flags or things you need to really worry about when someone comes in potentially with a concussion. And then it's got a little symptom checklist, not too dissimilar to what you might be familiar with if you've used the SCAT, which gets you to go through some things either with the patient, or the patient can do it independently, and they score a range of symptoms out of a given number. And then depending on what that number comes to, it gives you a sense of whether they're going to get better pretty quickly. So 90% of people get better in 4 weeks from a concussion, or whether they're going to have a more prolonged recovery. And it's all really encapsulated in a pretty easy to use tool, and it's designed for our New Zealand environment. So it's a good thing to have in your toolkit.
That's right, and it's not sport specific, is it? It's more for the general population.
Yeah, that's right. I mean, it just recognises the fact that people get concussed doing a whole variety of things that are not specifically related to their sporting pursuits.
And I think one of the things about the BIST that potentially is quite useful is that it helps clinicians categorise the dominant symptom or the dominant cluster. Can you talk a little bit about the way that I guess that the expert consensus groups are talking about with different treatment algorithms?
Yeah, I think it's really part of this move that we've seen over the last few concussion and sport groups. This is the group that produces the sport concussion assessment tool, the SCAT. Excuse me. We've really seen this move from a rest and wait and ride it out to a short period of rest, maybe 48, 72 hours, where you really try and wind things back mentally and physically to then move into a really active treatment phase. And what the clusters allow you to do is it allows you to sort of block together different groups of symptoms that people might have when they're concussed, and then you can layer on some intervention tools. So when people come in saying they're feeling a bit dizzy, or maybe they're having some difficulty reading or tracking, you might see that they score highly in a vestibular cluster. And then that's really useful because then you can target that with vestibular physiotherapy. People might come with a different set of symptoms. Maybe they've got neck pain, maybe they've got some difficulty with driving, and that might point to a cervicogenic cluster. And then again, you can target your intervention. So it just helps inform what you're trying to do now, which is reasonably quickly after the concussion, you're actually trying to get people to do something, and you're also trying to get them in front of the right people to do rehabilitation in the same way that we rehabilitate any other injury now.
Yeah, so I mean, I think for the GP audience, potentially it's a really good way of trying to decide what to do next with the patient. So high symptom score, potentially concussion service, high vestibular score, potentially physiotherapy assessment. And I guess for the physiotherapy audience, it is also a good way of trying to decide what to do next. This is a patient I should hold on to versus this is the patient I should refer on. Is that kind of how you're seeing it?
Yeah, I just think the good thing about it is that it answers the two key questions I think you need to answer when someone turns up and you're worried about their head. because that's what the situation is, right? Someone turns up, you're worried about their head. The first thing you want to be able to do is make sure that it's not something significantly worse, like an intracranial pathology, and the BIST has a nice series of red flags. So you can tick that box with asking the red flag questions and doing a targeted exam. And then you've got this great symptom scoring, which, as you say, Mark, just really helps your disposal. What are you going to do? Maybe they'll get better. Maybe they need a bit of physiotherapy. Maybe actually they've got such a high symptom burden score that they need a interdisciplinary concussion service.
Sure.
So, yeah, good tool.
So, Dane, one of the things that I think is increasingly clear over time, the more time I see patients with brain injury, the more I realise that one clinician type can't treat that problem often well in isolation. Do you think there's any role for sort of dietitians and nutritional strategies with concussion?
Yeah, I think one of the challenges, especially dealing with a lot of athletes with concussion, is the deconditioning compared to any other injury. So there's often a lot of, no exercise. There's a lot of potential for sort of muscle atrophy from just not doing anything. So I think it's really important to try to maintain a consistent diet. Also, the importance of sleep and just trying to maintain a normal routine. Appetite is something that can be impaired. So I think potentially consultation with a dietitian can be really helpful during that time to really put some good habits in place and just doing everything possible that might assist in recovery. And generally just a good healthy diet is the key, but it's not always possible during that concussion.
Yeah. So Adam's, yeah, go for it, Adam.
I was going to say I've seen a number of young females with concussions that have carried on for a while, and one of the symptoms that tends to drag on the most is fatigue. And I think it's a bit remiss if we're not doing a further blood test to make sure that there's not an iron deficiency that's going along with that, particularly if there's missed periods, stress, because there might be an underlying iron deficiency that's contributing to the fatigue. And I've found that when you treat that starts to get better, and some of the symptoms sometimes pick up. So I think use it as an opportunity to just make sure that we're not missing anything from a medical or a nutritional point of view that can, as you say, Dane, then we can start working on that to help optimise their fuel.
Yeah, and it can be a sort of double-edged sword. That fatigue then affects appetite, and the kind of circle gets bigger and bigger.
Yeah, I think that probably just aligns with that whole, when things are not going well, having a team approach almost always works well, whether it's a concussion or a knee injury or something else.